Hello everyone, you're welcome to the concluding part of the series of trainings we have been doing for healthcare assistant job interview preparation. Okay, we've been running a series of introductory topics from 1 to 20. Okay, this is the concluding part, and we've put together about 9 topics from 11 to 20. These are topics we've specially selected to be able to prepare you for the interview you might be doing during your interview for the position of the role of a healthcare assistant in the UK. All right, so we've listed out a couple of instances and scenarios that we feel might be the type of questions that the interviewers might be asking you, and we want you to know that it is not exhaustive. Okay, you are free. We even advise you to do your own personal study to improve on some of these introductory topics we have introduced to you. Okay, there are a series of topics, and the questions from the interviewer might come from any of these topics. So we just give you background knowledge on most of the topics, and it is advisable for you to go on your own personal study and check out more resources on all these topics as we have listed in the previous training and in this particular one also. So in this session, we have 9 topics from fire safety, manual handling, safeguarding children, catheter care, diabetes awareness, COVID-19, peg feeding, dignity in care, working in a person-centered way, and then lastly, risk assessment. Okay, all these topics are possible topics where your interviewer might decide to ask you questions from. Okay, and the previous 10 that we trained you on. So from all these 20, the interviewer can most likely ask you questions from any of these 20 topics. So we advise that on your own, to be well prepared for your interview, you should read more. Okay, read extensively. There are resources available everywhere on the internet and in libraries, or you can ask your supervisor where you are doing your volunteer work. I hope you guys are doing your volunteer work. Okay, like we said in our Zoom meeting, it is better if you don't have previous experience as a healthcare assistant. You can volunteer in the hospital to do some practical to get some practical training, and you'll be able to bring some of these trainings we have given to you to work. You can put it to practice when you are doing your volunteer work in the hospital. Okay, so that by the time you are asked some of the questions during your interview, being able to have done some of them while you are volunteering will help you to bring it to practice and answer your interviewer in the best possible way. Okay, because sometimes real life experience is always better, so that you can really know what you are doing. Some of you, it's at the point of volunteering that you realize that this particular job is not for you. Sometimes when we talk about the theory part, it's easy to say, but to get hands-on with these things might be a tough task for some people, especially when you're not used to helping others. All right, okay. So let's move on to the topics of the day. We have 9 different topics ahead of us. We'll be touching all of them briefly, and we encourage you all to go and do more study on all the 9 topics. This will give you more knowledge and understanding about these topics. Okay, this YouTube video is short. It's under 1 hour, and we cannot cover everything in detail. So we encourage you to go on your own and do some more personal study. All right. So we're going to be starting with fire safety. Fire is very important. Fire safety is very important. All right, wherever you are working, it's very important that you understand the fire policy of your organization. When you are working, your care providers, even before you start the role of a care assistant, they will have given you training on how to respond to fire alarms, how to switch on and off the fire alarm, panic fire alert, who to call in the event of fire, the fire safety marshal, and all of those things. So during your induction and your on-the-job training, these are things that you will be taught. Okay, so this is just an introduction for you to understand what fire safety, so that during your interview, if you are asked any question, the interviewer just want to see if you have any knowledge, if you have any understanding, any background knowledge. During your interview, don't panic. Okay, they're not searching for a fire marshal. They are not searching for a fire brigade response or somebody who knows how to put out a fire. All right. As a matter of fact, they don't want you to endanger yourself in the event of a fire. That is part of the reason why they will be training you during your induction, that in the event of fire, if you are not properly trained on how to use the fire extinguisher, please don't use it. Make sure you evacuate the building through the nearest emergency exit. Okay, we're also going to tell you about, you also need to know about the fire doors, the importance of the fire doors, and the importance of the types of alarm that you can hear in your when you what they mean. In some cases it's intermittent, some places it is continuous. They mean different things, depending on where you are working and depending on the policy of that particular organization, that particular care provider, or the care home, or the hospital, or wherever you are working at that point. Okay, so it's important that you understand these things, and these things you'll be taught the policy, and these are things you will be exposed to during your induction and on the job training. Okay, you don't have to worry. Just compose yourself during your interview and give them response. Sometimes the interviewer can ask you that, what will you do if you're taking care of your patient and you hear the fire alarm? All right, or you're taking care of your patient and you sight a fire, or there's a fire. The first thing to do is to raise alarm. Raise alarm. Okay, raise alarm. Fire, of course. When you see fire, shout fire, raise alarm. Okay, and you can also what's it called, you engage the fire alarm immediately. Both are ways of raising alarm. All right. Okay, so what is fire safety? We all know that fire destroys properties, it causes injury, and it can even take life. Okay, so a fire in the workplace can also mean that there will be loss of properties and all things like that. So with proper training, we can eliminate fire hazards and respond quickly and effectively if a fire breaks out. Okay, and without the importance is that if there is no fire training at all, okay, small incidents that are supposed to be curtailed, can grow quickly to become a major incident with very devastating outcomes. So that's the importance of having this fire safety training, which you will have in detail before you start your job as a healthcare assistant. Everyone is at risk if there is a fire. Okay, however, you see, there are some people who may be at greater risk because of maybe they have some physical challenges, or they have mental challenges. Earlier in our previous training, we spoke about people with dementia. Okay, people with that lack some level of capacities, people that have cognitive shrinking. Okay, I spoke about how someone with dementia can be cooking, for example, or can forget that they are cooking, that they can forget something that is flammable, and then it can result into fire. Okay, that's why such people, they need adequate and continuous support and supervision. Okay, so in such people, we can refer to them as being at greater risk. Okay, so they are because of they have challenge in their ability to escape from a fire, and that is also very important. So as a healthcare worker, okay, if you're also working in an unfamiliar environment, okay, where you are not familiar with, you don't know where to escape when there is fire. Okay, that can also put you at risk. The fact that you are able to move around, you also need to know where to go to, how to escape, the nearest exit. Okay, so those are things you need to train on when you start your job. All right, in case that the fire safety training can teach workers how to recognize fire hazards. For example, you don't put multiple sockets on an extension cable. If it's overload on the sockets, it can cause a spark, and that can result in fire. So training that you undergo will help you to know that you don't do such thing. You don't put flammable items, in the dustbin. All right. Those are things that you will learn during your training, during your induction. But these are just introduction for you to know that is important for you to be able to prevent fire, from happening. You have to understand how to prevent fire from starting, understand the importance of proper disposal of waste, and the importance of being aware of the meaning of fire alarms when it sounds. Okay, when you hear the fire alarm. All right, so you also have to know how to respond to a fire, how to recognize that of course this is fire, and then how to raise alarm immediately. So these are, and so in some cases, depending on where you'll be working, they might be teaching you how to use fire extinguishers. All right, because different extinguishers have different purposes. Okay, there's some extinguishers that are for material fire. Okay, there's some extinguishers that are for, what's it called, maybe fire from petrol. Okay, they have different types of extinguishers for different types of fire. The reason for this is to allow for efficiency in the use in the use of those extinguishers. If you are using the wrong extinguisher for the wrong source of fire, the likelihood of you getting that fire exterminated is very, very extinguished, is very, very is reduced. Okay, but when you use the right extinguisher for the right fire, then the likelihood of you getting a good result is possible. Okay, now before fire can take place, there are three major things that are necessary to be in place. Okay, for fire to happen, there has to be heat or ignition, something that causes the fire, heat, ignition. Then there also has to be oxygen and fuel. Okay, these are three major things that makes a fire to happen. They are called the three triangles of fire: heat, oxygen, and fuel. Okay, for fire to complete, the heat must be present, or the ignition, then the oxygen, once, and fuel. If you can remove supply of oxygen to fire, for example, by covering it, there's likelihood that fire will go off more easily. Okay, because you've taken oxygen away from it. It's like once something is missing from the triangle, the fire doesn't take place anymore. It loses that ring, and then because it has lost oxygen, then that fire will go out. Okay, you can take the fire out by removing the oxygen. So fire spread in through conduction, through convection, or through radiation. Okay, these are ways that fire spread, and you have to know that in your work, you have to make sure your electrical appliance, you don't overload your sockets. You don't try to fix electrical. Don't turn yourself to Mr. Fix It. Let an expert do things that are meant for expert. Anything that you don't know about, okay, anything that you're not trained on, please don't try to fix it. Okay, all right. So smoking, a lot of fire caused in the hospital are usually caused by smoking. Apart from arson, smoking is one of the major causes of fire in the hospital in the UK. All right, arson, like I mentioned earlier, is is a situation where someone sets it up. Some people are just they could set up fire maybe to harm themselves or to harm others. So you have to also be aware of arson. All right, and monitor people that are at risk of setting themselves on fire or setting other places on fire. Then cooking too. While cooking, it's important to ensure that everywhere is clear, tidy, and you keep flammable items away from materials that are combustible. Okay, that is very, very important. All right, so you make sure that while you are at work, you prevent risk and you assess every risk. You are aware of every hazard that can cause fire. You identify and you take a decision, to prevent fire from happening. right from the beginning. You always make sure that you do everything you can to prevent fire from starting up at the earliest possible stage. Okay, so the next topic we're talking about now is manual handling. Okay, manual handling. In the course of your duty as a healthcare assistant, you will be lifting items, you will be lifting people, you'll be lifting your patients. But don't worry, you at no point will you be lifting a patient with your bare hands. Okay, there are equipments, and there are equipments, and of course materials that you will be using to do lifting. Okay, because some patients are bedridden, they can't move by themselves. You need to help them to move from the bed to their wheelchair. So you will be using an equipment that is called the hoist. Okay, there are different kinds of hoist. There are some hoists that are operated, that are attached to the bed. Some are movable. Okay, and some usually is and in most cases, hoist is meant to help the patient, to lift the patient from one place to the other. Is an equipment that is connected to what we call what's it called now? It's connected to the what is it called now? Not the sliding sheet. No, I can't remember what it's called now. I'll remember during the course of the training. Okay, you connect the hoist, to the sling. Yeah, I think it's a sling. Okay, you connect to the sling, then you use it to. You connect to the sling. There are technical ways of using the sling to. You place the sling depending on the patient's situation. Some requires a lot of help in putting the sling, and some you'll be trained on all these things. It's a practical approach. That is why I said some of major things you would learn, are things that you're going to be learning during your induction and on the job training. How to use the hoist, you're going to be trained before you start the job. Okay, but it's better you check videos of how to use the sling and the hoist, and hoisting and a patient from bed to a wheelchair. You can check YouTube videos. You can just type hoisting, HOIST, the patient from the bed to the wheelchair, so that you see how it's done. You are not expected to carry patients with your hand. You use hoist to move them from the bed to their wheelchair if they cannot move by themselves. Okay, that is not to say that you will be moving all patients. Some patients are independent, they can move by themselves. So in such cases, you won't need the help of a hoist. So apart from carrying, or apart from lifting, lifting patients, which will be done with the hoist, of course. I've told you won't be lifting people with your bare hands. Okay, apart from hoisting, you might need to lift other items. So it is advisable that you don't lift items that would hurt your back. Okay, anything, for example, you might want to carry a box of tissue paper, for example, and if it is going to hurt your back, there is a position you have to be. Okay, when you are carrying, when you are lifting any type of item. Okay, so those are part of the things you'll be taught during your induction. Okay, you have to know the correct techniques, to be able to do this, appropriately without putting yourself at risk. You have to avoid back pain, musculoskeletal disorders, because it can affect your discharge of your duties if anything happens to your back. All right, if you don't want to be injured in the course of your duty, all right, and you also want to try to optimize your strength. Okay, there are some key pieces you need to know. There's some key things you need to know. You should not carry out any practical skill until you are assessed as being competent to do so. Anything you don't know how to do, if you don't know how to operate the hoist, or you've been trained after you got it and you are not really skilled, you've not gotten, you don't really know how to operate it yet. There is no crime in saying that you don't know how to operate it. Somebody will help you and put you through. Okay, your colleagues are always there to help you. All right, you have to understand the way of moving items safely to prevent yourself from being hurt. Okay, on a daily basis, you are going to be required to move and handle different loads. Okay, from rolling a bed through a corridor, turning a mattress, lifting or helping individual on the chair. Sometimes you have to help the patient from the chair, to the bed, or you are moving them from the wheelchair. For example, you are taking them to the lounge, and they're not going to remain on the wheelchair. You have to know how to move them, with the right equipment. Okay, sometimes you might need to use some, depending on the patient. These are things you'll be taught during your induction. Okay, how to pull a load, how to push, and how to hold in the right position, and things like that. Okay, so those are things you'll be taught. It's a practical topic, and most of it you'll be taught during your induction and on the job training. So number 13 is safeguarding children. Okay, while you are doing this job, depending on where you are working, you might be working with children. Okay, it's important that you understand that children are very, very at risk, because in the UK, children are treated with extra care. Okay, children are treated with extra care, and it's important that when you are taking care of anyone below the age of 16, you understand that they require protection. Okay, and you have to understand that safeguarding children is very important. Okay, it is very important. You have to recognize signs and potentials indicators of child maltreatment. Okay, in the display of your duty as a healthcare assistant, you have to be able to recognize different forms of child maltreatment. If, for example, you notice that a child is being abused emotionally, physically, sexually, or a child is suffering neglect, you have to report to the right authorities. Okay, you have to also watch out for radicalization, child trafficking, modern slavery, okay, and sexual exploitation. You have to understand the impact of you as a carer, on the physical and mental health and the well-being of the person you are taking care of, especially when they are young. Okay, you have to be able to you have to know how to refer to social care if you've identified any safeguarding concern. Okay, and you also have to know that whenever you notice anything that is inappropriate, you have to share it with your colleagues and your your line manager. Okay, so what is safeguarding children? Some of you that likes definition, let me give it to you. Safeguarding children is the process of protecting children from abuse, from neglect, basically preventing the impairment of their health and development. Children are gifts, and we need to ensure that they grow up in circumstances that is consistent, and we to strive at all costs to provide them with safe and effective care, so that they'll be able to, live an optimum life, and then proceed and then transform or maybe metamorphosize into adulthood successfully. Okay, so when you're protecting a child, basically it's about protecting them from neglect, from physical or emotional and sexual abuse. Okay, because children are, you have to make sure what in the side of your duty they are protected, and then your role and responsibility as a professional, is to look out for the welfare of the person you are taking care of, especially when there are children. You have to know how to identify safeguarding concerns. Like I said earlier, you have to inform persons for whom you have concerns, or anybody who reports safeguarding concern to you, that you are required to share the concern. Don't keep any concerns that you have seen. Don't keep it. You have to share it with appropriate authority, and you have to explain to them that you can't keep this. It's something has to be done. A child is involved. Okay. You also have to document anything you see when a child is involved, and so that you maintain it as evidence. You have to understand that immediate action, which you have to understand that immediately children they don't joke with children in UK. All right, so let's move on to number 14. That's catheter care. Okay, catheter care. That will not be strange for people who have worked in the health sector before, or for somebody who has taken care of an elderly person before. Okay, you will have heard catheter at some point or the other. Okay, catheter. For those of you who have not heard catheter before, you can see the spelling on the picture on your screen. Okay. Now, catheter care is very important because in your job role as a healthcare assistant, most of the people you are taking care of are either bedridden, they can't move from their bed, or they are so sick that they can't be standing all the time, to go and urinate. Okay, so it's important that you understand catheter, how to care for someone who is using a catheter. All right. So a urinary catheter is actually a flexible, it's like in a cylindrical tube. Okay, it's inserted into the patient's urinary tract. The primary purpose of the urinary catheter is to help empty the bladder of urine. The urine then is now collected in a drainage bag. Okay, because they can't be standing every time to go and urinate. So there is a urinary catheter attached that is inserted, into the urinary tract, so that whenever they want to pass urine, and it's not for people that can't stand up. Some people, they can't remember because they have dementia, for example. They don't know when they want to open their bladder. All right, so that they won't be urinating on their body. There is a permanent urinary catheter that is attached to their urinary tract. So at any time, all you need to do as a healthcare assistant caring for such a person is to be emptying. You empty the drainage bag. You empty the urine through the drainage bag. All right, and the process, you can see it. Just put catheter so that you can see how it's done, and you have to wear your gloves when you are emptying the catheter. There are two types of catheter. It might be the types that there is some that is permanent or temporary. Some that the temporary one is the one that is intermittent. Okay, they are temporarily inserted into the bladder at intervals, to drain the bladder of urine. They are removed once the bladder is empty, while the indwelling catheter remains in place for days. Depending on the type of catheter it is, they will be changed, to prevent infection. All right. So, because these are, so that is a catheter care. And when you want to remove the catheter, when you want to empty the urine, you wear your gloves. There is a switch, you're going to open so that the urine can flow into the drainage bag, and then you'll be able to just empty it, then lock it, and then put it back. It's very easy. Okay. Topic number 15. That is diabetes awareness. Diabetes awareness. That's a very, very common medical condition, and because it is common, you need to learn about it, because you are likely going to be taking care of somebody that has the history of diabetes. Before you start taking care of a patient, you need to know about, there's something they call care plan. All right, in their care plan, you will be told in that care plan if they are diabetic. Of course, that would mean that there's some kind of food they must not eat, to avoid possible complications, So maybe their insulin level must be managed, You have to understand what to do, in the situation where they have an episode. Okay, so to avoid them having an episode, there are things you have to observe, and be aware of. Okay, it depends on the patient. Sometimes it's what we call diabetes mellitus, depending on the patient, you know. Some worst cases of diabetes can cause blindness, you know. It can cause chronic kidney failure, you know. In some cases, some people even end up having their knee amputated, okay. And it is because of the increase in the glucose in their blood, okay. This is what causes diabetes mellitus. All right, diabetes mellitus is caused by the increase in glucose in the blood. Too much sugar in the blood. Glucose is the sugar that you get from food and drink that contain carbohydrates. So in Nigeria, we eat a lot of carbohydrates. We should be mindful of carbohydrates. It's not only sugar that increase the glucose in our blood. Carbohydrates, too much carbohydrates. Eating eba in the morning, eating rice in the afternoon, eating amala in the night. Too much carbohydrates. Okay, it's important. I think in previous training we have discussed nutrition. Okay, understanding nutrition. So this training is for everyone, even if you're not thinking of taking the role of healthcare assistant. I mean, you can learn that, you know, diabetes is not caused only by consumption of sugar. Eating carbohydrate too much, excess consumption of carbohydrates can actually lead to increase in glucose in the blood. Okay, so these are things you need to know. When you are caring for someone that is diabetes, you need to understand their diet plan, okay, so that you will be giving them too much carbohydrates in their meal. All right, so that you will know the type of food, you know. And some of them have insulin that they take, you know, those ones that need to take insulin, you know, maybe those ones with that lacks that is depending on the type of diabetes they have. In some cases, you know, they have to be tested regularly. Their blood sugar has to be tested on a regular basis, depending on the type of diabetic patient they are. Okay, so that is for diabetes awareness. So topic number 16, which is COVID-19. COVID-19. Some people say COVID has come to stay. I pray that none of our family members will be a victim of COVID-19. It is not a pleasant experience, you know. That's why I've encouraged everyone who wants to work as a healthcare assistant to get vaccinated. Okay, it has been one of the most challenging healthcare emergency in recent times. All right, you know, it is some of the challenges, you know, that COVID-19 virus has brought, you know, has left, you know, some families, colleagues, you know, nurses, doctors, you know, has left them in pains. Okay, they've lost colleagues, they've lost loved ones. So you have to take precaution. You have to understand COVID-19, you know, what it is, how to prevent yourself and people around you, you know, because it's a virus, you know. COVID is caused by virus, you know, and it's very small. You may not see it, but you have to protect yourself. I mean, nobody needs to be told now that COVID is around, you know, and you have to ensure you protect yourself from possible ways of transmission. All right, I mean, wash your hands, cover your nose and your mouth, you know, use your PPE when you are, you know, caring for people who are on isolation or who have suspected cases, you know. Yeah, so that is for COVID-19. You know, we have to reduce risk from ourselves to others, you know, social distance where necessary, you know, wear the appropriate protection, you know, face shield, nose mask, hand gloves, you know, make sure you are fully vaccinated, you know, with the different kinds of vaccine, Pfizer vaccine, you know, there's the AstraZeneca vaccine, you know, depending on which vaccine is available, as long as the health authorities have approved it, make sure you get yourself vaccinated. It's very important. And don't forget, hand hygiene is very important, you know. Make sure you always wash your hands, you know, when you're at work is very important. The interviewer can ask you, how do you protect yourself? Just mention all these protective things. PPE, wash your hands, cover your nose, use your hand sanitizer when necessary. Have short nails, don't wear jewelry because jewelry can carry bacteria and you won't know. Wash your hands after removing your gloves, after using the toilet, after blowing your nose, before blowing your nose, before you eat, after you eat. Just protect yourself in every way you can from COVID. Wear your PPE, wear your gloves, your apron, your face shield where available, your face mask, you know, make sure it is covering your face very well, and make sure that you protect yourself. Okay, if you have symptoms, you have don't go to work when you are having any symptom. You are coughing, high temperature. If you lose sense of taste or smell, don't go to work. Make sure you do a PCR test. And if it is positive, you must isolate for 10 days. Drink lots of water during your self-isolation and pray. And I'm sure God that answers prayers, will heal you and you will recover by the special grace of God. I don't pray any one of us catch COVID, but those are the rules when it comes to working as a healthcare assistant. If in the event that you catch COVID, you must do a PCR test and then isolate for 10 days. Then you can, after then you recover and then you can return to work. Okay, so let's go to the next topic, please. Peg feeding. That's number 17. Peg feeding. In the course of your role as a healthcare assistant, some patients, they are so ill that they can't even feed themselves. Okay, apart from the fact that they can't even feed themselves, it's they need, there is a special equipment, that has to be connected. It is called that part of particular equipment is like a tube, is percutaneous endoscopic gastrotomy tube. Okay, that's big grammar. Just don't bother yourself about it. But all you need to do is to understand that there is something called peg feeding, and for you, those of you that are interested, it can help you because you never can tell where the interviewer will be asking a question from. It can ask you, are you familiar with peg feeding? So, but if you've done your own personal study, you'll be able to answer questions regarding peg feeding. Because when you're caring for someone and the person requires peg feeding, you have to adhere to infection control policy and procedure. Very important. Okay, you have to understand how to manage peg feeding tubes. Okay, because usually it takes a lot of dexterity, a lot of care, because there's some potential complications, that can come up, when you are, and the right positioning, for somebody that is having peg feeding. Okay, so you need to do your personal study on that so that you can have some basic understanding, on what peg feeding is, what it means, how it is done, what it looks like, and why it is necessary in some cases, to introduce, why some people are using peg feeding. That is for peg feeding. That's number 17. So number 18, the topic number 18 is dignity in care. Okay, dignity in care. That's number 18. Okay, dignity in care. Number 18. So when you are working as a healthcare assistant, you have to understand that it's important to maintain the dignity of your patient. Okay, the dignity of your patient. It is very important. All right, because for example, you want to care for your patient, you have to maintain their privacy. Okay, they are human like you, and you want to, for example, change their diapers. You make sure you let them know, you introduce yourself when you enter their room. For example, you announce your presence, you introduce yourself, you explain to them what you are there to do. You shut the blinds to protect their dignity. You shut the door, and you ask for their consent before you touch them at all. The fact that you are there to care for them doesn't mean you just go and start touching them and doing stuff. Okay, you have to announce your presence, tell them why you are there, and ask for their consent whether they are okay for you to proceed to care for them. Okay, you have to appreciate, as a healthcare assistant, you must appreciate the importance of dignity in healthcare. Okay, privacy is also important. You have to, people like confidentiality. Okay, uh, you have to know areas and ways to maintain dignity of your patient. You have to know, as a care provider, as a healthcare assistant, how to maintain privacy and dignity always. Okay, it's very important. And you have to know who to report dignity and privacy concerns to. Immediately anybody is complaining, you have to tell your manager. Some people are asking, what is the meaning of dignity? If you don't know what dignity means, dignity focuses on the significance and value of every person. Everyone is unique, and things that upsets us varies. Okay, so we're all unique as individuals. We can demonstrate our commitment to upholding other people's dignity by the ways in which we treat them. You have to treat others fairly, the way you yourself want to be treated. Okay, so, and basically that's in simple terms, that's with care and compassion. Okay, we respect others' views and choices and decisions. Don't make assumptions that this is what they want. Make sure you ask them how they want to be treated. Ask them when you want to care for them. How do you want to be cared for today? Show some respect. Just the way, put yourself in their shoes. Show some empathy. Because privacy is also important. Privacy is when you because you are the healthcare assistant and you are exposed, you have the liberty to know personal things about them. You have to keep it private for them. All right, you have to keep their privacy. Okay, very, very important as a healthcare assistant, because you're going to be supporting them. You're going to be, this is very, very important that we don't walk into patients' room without knocking. Before you enter your patient's room, you knock and wait to hear. So those that can't talk, just knock. At least that announces that somebody is coming. That's the way to demonstrate. The interviewer can ask you, how do you demonstrate dignity and privacy? By knocking the door before you enter your patient's room. By not ignoring a patient while carrying out another task. When you're doing something and they call your attention, don't ignore them. Another way of maintaining dignity and is by when you want to perform personal care for them, you ask before you go on. You gain their consent. That is a very important way. Then you greet them. Good afternoon. How are you doing today? It doesn't cost anything. It's just about maintaining dignity. Okay. All right. So there are some basic principles of dignity, which I'm quickly going to mention. Number one, you have to value the uniqueness of every individual. Everybody is unique. Okay. Value the uniqueness of every individual. Every person you are caring for at any point or the other, is a unique human being, with their own set of beliefs, opinion, views, likes and dislikes. Before they became ill or before they needed your help, they were fine. So when you become busy working within the healthcare service, you don't forget, and start referring to people or these patients as numbers, or start calling them by their condition. Yeah, like saying that dementia man. No, it is wrong. Call them by their name. Okay. Number two, you have to uphold the responsibility to care and support each individual. You have to uphold your responsibility as a healthcare assistant. Your role is to care and support them, nothing more. Okay. Number three is to value communicating with individuals in ways that they understand. Okay. Don't mock them. When you are caring for them, don't start talking in your native language. Okay, it won't be nice because they don't understand you. It could be degrading. So number four, you have to recognize and respect how an individual dignity may be affected when supported with their personal care. For example, you are trying to wash somebody's private parts. You have to be gentle. You have to understand that the person may not be pleased. Okay, so you have to approach it in a way that protects their dignity. Number 5 is to recognize that an individual's surroundings and environment are important to their sense of dignity. Okay, they want their room, everything around them to be arranged the way they want. So ask them how they want their room to look. If they want the windows open, you ask them. If they want you to put on the fan or the TV, for their pleasure, you ask them. Don't just put on the TV because you feel you want to put on the TV. Okay. So another thing is number 6 is to value workspace culture that actively promotes the dignity of everybody. Everybody work your colleagues. You work as a team, so you respect everybody, even your colleagues. Number 7 is to recognize the need to challenge care that may reduce the dignity of an individual. If you see somebody doing what is not acceptable in the ethics of your profession, you must let your line manager know. Okay? All right. That is dignity in care. All right. So the 19th topic is working in person-centered way. Working in person-centered way. What does it mean to work in a person-centered way? What does it mean to work in a person-centered way? Okay? A person-centered way is the type of work where you put the patient, at the center of the care you are giving. Okay? You're going to be supporting an individual about their health, but basically, you're going to be putting that person's needs, their wants, their values, how they want to be taken care of, how they want it. You're going to be putting their dignity, in the center of the care plan. If they say they want something, that's how they want it. If they say, they don't want to be given medications, if they say they want to sleep early, you have to respect it. That is an example of working in person-centered way. You can't say because you will be awake at that time, or others will be awake at that time, you cannot sleep. No. A person-centered approach is key to supporting people when caring for them. Very, very important. Okay? Being person-centered means that every person you care for is recognized as an individual whose experience will differ from others. So it is important that people requiring health care are involved in planning their own treatment plan. Not basically treatment plan, but how you will care for them. And person-centered care means that everyone should be included in healthcare planning. Of course, they will be included in planning that concerns them. This person-centered care creates a more supportive and less threatening environment for everyone you care for, because they know that, okay, they are involved in that decision, to care for them. These are values that make life easy for them. It helps. It shows that you respect them, and you understand their unique set of needs. You understand, you appreciate their views, and their beliefs. Okay, because you put all these things into consideration, when their choice, their independence, their rights, their privacy, their dignity, you show them respect, and it's a form of partnership. When you are planning their care plan, when they are caring for them, it makes them feel something they call self-inclusive, person inclusive, or whatever term you want to call it. They feel included. They feel, involved. So for people that are receiving care, that kind of approach makes them feel like, they are listened to. It makes them feel valued. Okay, so person-centered approach is, if your interviewer asks you what's the best way of caring for your patient, your response should be person-centered way. Simple. Person-centered way. So working is very crucial, working in a person-centered way, when you are caring for someone else. Okay, because that helps you to maintain their dignity. Everything you are doing for them, even if you are the one doing it, it shows that if they happen to be the one doing it by themselves, it won't be so different from what you are doing for them. Okay? All right. So the 20th one is risk assessment. All right, risk assessment. Whatever you are doing as a healthcare assistant, you have to assess before you make any move. You assess the risk. Anything as risk assessment. At every point in time, you're assessing the risk. You are thinking, oh, is that cup too close to the bed? Can it spill on the bed? You're assessing if as I'm pushing this wheelchair, what is in front is it gonna, can it hit the leg? Can it injure? You're assessing. Risk assessment is something you do subconsciously. At every point in time, you are thinking, is there anything that that poses risk? Is there anything that can cause risk? Is it fire? When you are doing, you see, this risk assessment is interwoven. It concerns fire. It concerns fire safety, manual handling, even children. Even the catheter care that we discussed earlier. You look at the is there a likelihood of the catheter tube spilling the urine? Those are risks you assess. Even while you're working, you're protecting yourself from COVID-19. You assess that as I'm entering this, did I remember to wash my hands when I left the toilet? Am I using the right protective equipment to protect myself from COVID? These are things you do. Risk assessment is very, very important. Okay, because it's something you do continuously while you're at work. It's a dynamic thing. The importance of managing yourself and the patient, protecting and preventing risk, uh, from happening. Okay, identifying hazards and preventing risk. Okay, you identify an hazard and you prevent the risk. Okay, so you have to be able to, in the event we are not perfect, in the event that anything happens, you have to write it down. And if you notice that something is likely to cause an hazard, you have to assess it, then put it down in record and report to your line manager. Okay, that this thing poses a risk, and to prevent it from escalating, report it immediately. Anything that has risk factors, record it, and different kinds of risk. Some are current, some are long time, some are situations. Some are acute. So it depends on what you know. For example, you might be asked, somebody with a history of somebody that is suicidal and is left alone in the room. What is the risk to such a patient? Such people who have high risk, you don't leave them alone. So that's your answer should be they are on one-on-one, 24 hours monitoring, in such a situation. Okay? All right. So that is for risk assessment. Okay. So we've been able to talk about all the 9 topics, and it's just an introduction. I encourage you to go on your personal learning, go and search for more resources to help you to understand these topics the more. The interviewer can ask questions from any part of these topics. It's just for them to check if you have any background knowledge. Nobody expects you as a new healthcare assistant to be an expert in these topics. Okay, but the interviewer wants to see the little experience you've had, what you can do and what you know about some of these topics, the background knowledge you have. Okay, so do your personal research, more study on these topics, so that you have more understanding on them. It will help you during your interview. Uh, After your interview, you'll be shortlisted. I wish everyone the best, and I encourage you to look at all the videos and learn more. Write out these topics and learn more on them. It will help you. Okay. Keep up the optimism, and I look forward to hearing your good testimony about how you were able to take advantage of all these trainings that we have been doing, just to be able to help you get the background knowledge you need. We have introduced some of you before now, you don't know these 20 topics. These 20 topics I can tell you, if you have all this knowledge on these 20 topics, there's no interview that you won't be able to perform well in. It will help you during your interview. And I know that you'll do well, when you've prepared for your interview. Okay, you don't know where the questions will come from. So read all these 20 topics, do your personal study, check other outside resources,